The passage of the recent healthcare reform legislation has made the delivery of healthcare in America a hotly debated topic. And no matter what the final outcome of that debate is, we know that we are going to have an extraordinary period of transition and change over the next 10 years. One of the ideas that's being talked about is the need to bring back the old-fashioned home visit as a way that we can connect to patients and to help reduce our costs. Well, we at the VNA feel that we are experts at providing home visits because that's all we do. And there is nothing old-fashioned about it, particularly given the sophistication of the technology that we use today in home care and hospice and the complexity of the patient care needs that we are encountering. We see patients today who would have required the services of an intensive care unit in the not-so-distant past. Infusion therapy, patients with tracheostomies, patients with ventilators, patients who require frequent monitoring of their vital signs, and patients who are dying at home. All of these are services that VNA provides that make it possible for patients either to come home from a hospital or to remain in their home as their illness progresses. Our staff utilize a wireless, handheld, electronic medical record. It's about this big. And that allows them to access information on their entire caseload and to share information among the entire team, including our physicians, in virtual real time. We have a telehealth program that allows us to remotely monitor vital signs, weight, oxygen levels, and to reinforce the teaching of our staff in between home visits. Our physicians can now monitor how their patients are doing via an electronic portal. They can send orders to us, they can change orders, and they can make referrals. We use advanced technology in wound care products and computerized infusion therapy pumps so that medication can be delivered more accurately and in a way that fits into our patients' lifestyles. In the not too distant future, we will also be able to communicate with our patients via a secure web-based portal that allows us to problem solve while situations are developing, again, in between the home visits. It's a great advance that's going to be coming very, very shortly. VNA services help patients regain the control that illness takes away from them. And it allows patients to achieve whatever level of independence they're capable of so that they can manage in their homes. The hallmark of the Visiting Nurse Association of Mercer County is a long-standing commitment to the communities we serve, a mission to provide progressive and compassionate home care and hospice services that we strongly believe in and that we live every single day. And a track record of not being content to sit in the shadow of our past accomplishments, but rather look ahead and ask ourselves, what else is needed? Where can we be in service? And what's it going to take to make that happen? Our VNA is very good at adapting to change. And let's be honest, we're going to have to be very good at adapting to change in what's coming for all of us in the years ahead. But we believe that this organization has such a strong foundation, has so many dedicated, creative, flexible staff. We have the support of our board, of volunteers, of people like Dr. Tedeschi, and we know that this organization will find a way, no matter what the challenge is, we will find a way to continue to serve our communities.
The visiting nurse take great pleasure and with a lot of pride to present Dr. Tedeschi, or as we fondly call him, Dr. T. That's his hospice team. I think we all know Dr. T as family practitioner, does a great job. Hospice medical director for the VNA of Mercer County. I think everybody around here knows he is a pilot, loves to fly. He does very beautiful sculptures. We know that he is a loving husband, and he is definitely a good friend. At this particular time, present this plaque to Dr. Tedeschi, and I will read it. For the 2010 Physician of the Year, this is presented to Dr. John Tedeschi, fondly known as Dr. T, in appreciation of 7 years of hard work and commitment to the patients and nurses of the Visiting Nurse Association of Mercer County. This award honors an outstanding family physician who provides patients with compassion and comprehensive care and serves as a community role model, professionally and personally, to other health professionals and to the residents. This is presented April 30th, 2010 to Dr. Tedeschi.
Thank you. Thank you. Thank you very much. Thank you. Thank you. And thank you for being compassionate enough to understand what the VNA is all about and the wonderful staff that's here. I'm happy that you're all here, and I'm truly honored. I'm humbled and deeply grateful that you would present such an acknowledgement towards me. With deep gratitude tonight, I accept this honor on behalf of all doctors, all nurses, who have selflessly cared for and continue to care for those sick and infirmed. Most of all this evening, I accept this as a tribute to Melvina Williams, Vice President of Patient Services and Chief Operating Officer of the VNA Mercer County. JoAnne Ruden, President and Chief Executive Officer of the VNA Mercer County, and as a tribute to all the wonderful and compassionate nurses here tonight and that are not here tonight. You've taught me, you've been patient with me, and I know you've been patient with me, but you still inspire me. I have to learn. There's not much time left. I must say it's been very refreshing for me to witness and work with the nurses of Mercer County VNA. They are truly altruistic and compassionate people. All of you have shown a good heart, universal responsibility, and kindness to all your patients, regardless of where they come from, where they came from, whether they have a religion or they don't have a religion. And for this, I am deeply grateful. Thank you very much for all of you being here and supporting this great cause. God bless all of you. And may contentment continue to raise within you during your great work. Thank you.